everyone's in this boat, and all the teachers next year are going to know to accommodate for everything that was lost this year. And everyone across the country, the world, is going to be a little behind next year, but we'll all catch up as soon as we can.
Shorter way of saying it is that that this virus doesn't kill people. It's the immune response to the virus that kills people. And so this is really an immune disease, trying to understand why some people whip up such an immune reaction so that they end up dying versus other people don't. Turns out to be a really fascinating, bigger picture question about how our bodies regulate our own immune responses. So we think that many of the comorbidities that go along with risk, obesity, diabetes, et cetera, those are all driving the immune system to be more active, more dysregulated, so that when it does get turned on by COVID-19, by the virus, it can't turn itself off as easily, and it gets into this protracted inflamed state. Beyond those people who are elderly and who have comorbidities, there are a number of patients, young and old, who have also succumbed to the virus. And that also raises a question of why some people get sicker than others with this disease. There's some people who get it and have no symptoms, and other people who get it and get very, very sick. And so beyond the other risk factors like diabetes and hypertension and obesity, there are probably genetic factors, things that we are born with that make us more susceptible to not just to the virus, but also to our own exaggerated immune response to the virus. The patients who don't have other risk factors turn out to be rare. In the New York data set, they're probably, which is the largest data set in the United States, they turn out to be under 10%, maybe even under 5% of the people who get COVID-19 fall into that rare disease category. And so the vast majority of people who actually end up getting sick from this virus are either elderly or have those known comorbidities, those other risk factors that we can check off on a list relatively easily: diabetes, hypertension, obesity, etc. That means another way of flipping that around is that the vast majority of people who get this infection, if they don't have those comorbidities, if they're not elderly, they are only rarely, if at all, going to get very sick from it. That's been a very reassuring piece of data that's come out from now almost every country in the world that has published on this has been in agreement that the rate of dying from this infection is well under 1%. So that's a lot. When you multiply it by 300 million people or by 7 billion people in the world, you'll still get quite a few people who are dying from this virus. But it is not the kind of species-ending virus that maybe we were worried about in the very beginning. The way SARS and MERS, the other major epidemics from this family of coronaviruses that were 8 and almost 20 years ago, this virus is not like those viruses. It does not kill at a very high lethality rate. It's under 1%. According to the CDC a few weeks ago, it may be under 0.5%. So in ways, that's very reassuring that 99.5% of the people who get this infection are going to live through it. The basis of closing schools was always an interesting decision because all the data have pointed to exactly what you said, that the kids are incredibly protected from in this viral infection. Almost no deaths are reported in kids. For example, in all of California, there have been no deaths of children from this virus. Being the biggest state, we have not had the same kind of impact as other states. But when you go looking to even bigger data sets like New York or in Italy, the number of kids who get infected may be high. The number of kids who die from this infection is extraordinarily low, even lower than the pre-existing condition rate might tell you. For example, in some parts of inner city New York City, 1/4 of the children have asthma, but a fraction of a percent of kids who get COVID-19 die. So that tells you that asthma is not a risk factor or a pronounced risk factor in this disease. And similarly for congenital heart disease and even organ transplants. It looks like the kids 0 to 5 are at slightly higher risk than kids who are 5 to 18 in the New York data set. And I'm talking about like 1/50th the level of risk of the people who are 19 to 44. Okay, so like you're talking about extraordinarily small numbers, but these numbers are higher in the very young than they are in the slightly old, in all the school ages, basically. So if you look at the CDC data for California or for the whole country, it's about 4 children per 100,000, which would mean for our school district would be about 0.4 kids would be expected to get hospitalized. The California data would predict around 0.1 children for our whole school district. The nationwide data, which includes New York and New Jersey and all those other places that are harder hit, would predict about 0.4 children for our whole school district getting hospitalized. So if you wanted to round
and zero fatalities.
And zero fatalities, right? So if you wanted to round upwards, it would be at most one child in the school district would require hospitalization. That's based on the data thus far. Obviously, we haven't had a severe wave here, but this is even considering like New York's data. So why did we close the schools? This lesson came from the 1918 Spanish flu and from the subsequent epidemics of influenza, where counties and districts and countries that closed their schools early had less deaths. And the lesson may be that that kids themselves may not be susceptible, but they carry the virus, they can be infected, and they can carry the viral infection, and they can spread the viral infection to people in their homes. So when there are people with susceptibilities in their homes coming into contact with kids, the infection will spread throughout the household. And that might mean then a child, relatively safe, can spread it to their grandparent who has obesity or diabetes or hypertension and put them at extraordinarily high risk, even though the child themselves may not be at high risk. So that is an important point from our history, from the last century of epidemics of influenza, that is a lesson, and the lesson was applied in this case. The other thing that's really important about this virus, more so than influenza, is that the infection can spread even when people aren't overtly symptomatic. So when they are pre-symptomatic, as it's called, their symptoms might come a day later or 2 days later. They may still be in a state of having enough virus in their secretions that they can spread it. That is unlike influenza. Influenza typically only spreads after you've developed enough symptoms yourself that you are sneezing and coughing and spreading the virus on other people. So because there is this state of pre-symptomatic spreading, this virus actually spreads better and faster than influenza. So combined with the lessons of the influenza and epidemics in the past, plus the fact that this virus is actually much more spreadable than influenza, the decision was made to close the schools based on that rationale.
Because I'm a physician and because I do research, I'm very much data-driven. I find comfort in knowledge. I think that knowledge is power. So the more information I have, I feel more comfortable, talking to patients, talking to people in the community, and protecting myself. But hospitals and clinics and the profession in general, in conjunction with scientists and public health officials, really have put forth some very important sort of rules that if we adhere to, the vast majority will protect ourselves and our patients. And that is universally masking, distancing ourselves as much as possible, meticulous hand washing, and disinfecting surfaces. And when you combine those, maybe one or two may fail, generally transmission is going to be low.
People are publishing large data sets, the groups in Italy, the groups in South Korea, the groups in China and Japan, and certainly, of course, in the United States and New York, leading a lot of the way because they've had so many cases. To just be able to ask questions like, what are these risks? What kind of children are likely to get infected? What kind of households of children are the ones that are likely to cause the spread? How many days does it take to know whether this household actually got a household contact infected or not? All those questions are being answered right now. And the public health people and the doctors and the people who care about this field are reading those papers. And I think as we head into the summer, we need to talk about those data and make rational plans with them.
One thing I realized with the pandemic and with COVID-19 is that things change, day by day, week by week, month by month. So I've tried not as a parent and even as sometimes as a physician to have a crystal ball, because if we think something's going to happen, I think we can be potentially emotionally let down, right? So I would sort of begin by saying this is somewhat uncertain and I'm willing to sort of go with the flow. With that being said, if the experts, the physician scientists, the public health officials, et cetera, from both national and state and local communities believe it's safe to go back, right? I would send my children.
And at the moment, I don't think there is this reassurance in place, because again, the government repeatedly and shamelessly has failed to provide the very basics like testing, contact tracking. There's nothing in place. So I don't think children, and especially the teachers, should be put on that position of risk.
I've been trying to stay on top of what the DOE is doing, and there have been some webinars that I've been a part of where they're seeking parent input or talking about, here's what the Department of Health wants us to do before opening up, or, these are the rules we'll have to follow if we open up. Summer camps or summer school is allowed to open, but my school is going to continue doing it remote because they didn't feel they had time or could accomplish any of those distancing rules. Like, how do you keep kids with sensory issues in masks all day? How do you keep kids who, like to chew on things from setting it down just anywhere? I mean, that was always an issue in our classroom. We have a couple kids who drool a lot or chew on their shirts. So how do you have kids in school not sharing materials? You need more money, you need more funding, you need, to be able to afford that everyone has their own set of markers, their own set of scissors, or all of these things that normally in, early childhood classrooms, we all share. Blocks are that's a team playing sport. We wouldn't all be able to take the elevator together. We wouldn't all be able to go from classroom to classroom together. Oh, and school busing here is a nightmare. So I don't know, in a regular year, it's a mess. I don't know how, and that was one of the reasons the school I work in right now is not going to open for summer school, is that the school buses couldn't operate. They're like, nope, we can't do it. So many things to consider that we don't normally consider.
School is supposed to be interactive. School is supposed to be, engaging, interacting with your classmates, interacting with your teacher. That's a really important part of what school is and what school should be. When you start talking about doing temperature checks when they're, walking in, and social distancing, 6 feet apart in the classroom. I mean, part of me wonders kind of, what's the point if you're going to do that? It would almost make more sense if, not that I think it's a good idea, but if someone said, well, if we're going to go back, let's just go back, as opposed to let's go back and try to stay away from each, try to keep a distance from each other. I mean, I just don't see how it's going to work. It's imagine a kindergarten class. And I mean, every grade level has their, challenges with social distancing. In middle school, it's, you might have that rebellion, it's like, oh, I don't need to social distance, or, let's do this or let's do that, or, pull this prank. And in high school, it's other stuff, whatever, boyfriend, girlfriend stuff, or I don't know, whatever stuff high school, kids, reasons they want to not social distance. And, because these are their friends, they're going to be surrounded by their friends who they may not be able to play with, who they don't play with or hang out with regularly because of social distancing. And now they're in the same classroom or in the same, and they're not supposed to even touch the same books or pencils. I mean, it just seems like just really far-fetched that social distancing in a classroom setting could work effectively. And what teachers are supposed to wear masks and teach with a mask on, and you can't, I mean, when I teach, I'm constantly walking around amongst my students, you know. If they're taking notes, I'm checking their notes while they're taking them, you know, like a formative assessment. Are they understanding? What are they understanding, you know? At any given time, I know what every one of my students, you know, kind of roughly where they're at in their learning on a topic. And the reason I know that is because I'm like, you know, monitoring. I'm walking through the classroom, and when they're on their computers and they're like doing the coding lesson after I've taught them and they're working on it, I'm seeing, and I have to, like, you know, be there behind them looking at the work that they're doing. And you can't do that from 6 feet away. You can't see, you know what I mean? You can't see the screen. Sometimes if there's a discipline issue, students acting up, you know, I go up to the student, you know, if they're sitting in their desk, and squat down, and I have like a quiet,
Right.
you know,
Yeah.
you don't want to call them out in front of all the other students, but if you're 6 feet apart, you know, what are
Yeah,
you
you
gonna
can't
do?
have a quiet conversation with the student.
And just sort
Yeah.
something out, you know, which
Yeah.
is, you know, which oftentimes in middle school, you know, a lot of times that can work, you know, they just need to, like, you know, just talk to us and privately, you know, without putting them on blast. I don't know, the kids are going to walk on opposite sides of the hall, you know, if you're going that way, walk on this side of the hall. If you're going that way, walk on this side of the hall. Or are they going to have arrows? And, you know, where are they going to, how's lunch going to work? What, there's no more PE, you know, PE is like basketball and different things like that. You can't social distance and play basketball. And, you know, the socializing aspect of school, which is huge, right? And it's important, you know, I mean, for kids, that's where all their friends are. That's their social life, you know, largely. I just don't want the whole idea of what school is to get damaged for kids who are just starting school, or for kids who already, like, kind of struggle with school. I want, you know, I don't want them to think that school is like this weird thing where they take your temperature and make you wear a mask. And I know it's temporary, but somehow I think it's just bad modeling. We shouldn't model school as being something that a place where you can do that. You know, I think we should come up with a different idea.
To be completely honest, I'm really hoping that people have a choice. Here's my fantasy. You tell all the parents, school as you knew it before will exist exactly the way it was before. If you would like to come in person and have class with no masks and no rules and exactly the way it used to be, you can sign a release that we're not responsible for any catching of the thing. And choice number 2 is you want to be homeschooled and you believe in quarantining yourself. And if you're a teacher who wants to be a homeschool teacher, then you can be a part of that entire giant new formulating, you know, making a whole curriculum and being a part of that team. Or if you want to go back to the school and do it like it was before, I do not want a hybrid.
I don't expect schools to operate the same way that we operate in a hospital. But I do think that there are some measures that will have to be put in place to protect children, to protect teachers, which is very important, and to make sure we're in line with the science and, you know, protecting the community at large.
We've done, you know, a good job of slowing down the spread of the virus, of flattening the curve, but it has not been like an elimination in this country at all, right? In California, for example, the number of cases has steadily increased the whole time that we have been going through COVID. There's been no flattening. There's been no, you know, at best there's a plateau here and there, but we are steadily rising the whole time. Now our total numbers are quite low compared to New York and New Jersey. But as much as social distancing and masks and everything here has been implemented, and we're one of the earlier adopter states, it has not eliminated this virus from spreading at all. In fact, it continues to spread. So I think that is a reality that we have to keep in mind, that in a diverse and very complicated culture like ours, as compared with South Korea and in the Scandinavian countries, et cetera, where you can implement social measures and have them actually be followed. Here we have lots and lots of complexities to that, more than those places. And empirically speaking, we're only so good at stopping the spread of this virus. We're just not that great at it. We're good, but we're not great. Okay, so if that's the reality, that the best we can do with the most effort that we can apply results in some flattening and some mitigation of spread, but not elimination at all, then the conclusion you have to draw from it is that the virus will continue to spread. And it will continue to spread to our children and to the adults in our society until we have a vaccine, until we have treatments that make getting the infection so tolerable that the risk of death goes down. And I think we're very close to both of those things right now. Like, we have treatments that are already being used that reduce some of those risks, and we have vaccines coming. So I feel like we're at the point where we can see a light at the end of the tunnel in terms of not eliminating the spread of the virus. I think, I'm not saying it's hopeless to eliminate the spread of the virus. I'm just saying we're not very good at it, and I don't have a lot of hope that we're going to figure it out. But rather, I think if we can mitigate the fear and the risk of getting the infection, of saying, okay, you know, my uncle caught the infection, but, you know, he got this treatment and this treatment and that treatment, and he got over it, and he was back home in 2 weeks. Like, if you felt like this virus was not going to be fatal, and remember, it's mostly not fatal, 99.5% not fatal. But if you felt like you were in that 0.5 group, and you knew now there was a treatment available to even lower your risk further, I think that would make people a lot more tolerant about the notion that their kids could be exposed to it, could get sick from it, could bring it home to them. They might feel more tolerant about that level of risk.
I'm not even sure if we had a vaccine for COVID-19 that all families would vaccinate their children. Beyond COVID, there's a lot of families who don't operate the way you and I operate. You know, we have different standards, and the question is, you know, what is your threshold? You know, because we still have to be respectful and mindful of everyone. For example, flu shots, right? Now, COVID-19 is not the same as influenza. We all know that. But here, you know, we know that influenza can be deadly. It absolutely, the mortality in children, right, is quite high. You know, the young, the old, and the immunocompromised face a high mortality with influenza. Now, with COVID-19, children seem to be spared for a lot of reasons. But yet we have a large segment, Amira, in Los Angeles, you know, particularly within the city, who don't vaccinate their children, who decline the influenza vaccine. Knowing that if you vaccinate, you not only will decrease the risk of your child being infected, that if they do get infected, their symptoms will be less severe and will not last as long. They're less likely to go to the emergency room. They're less likely to be hospitalized. They are less likely to die, and they're less likely to spread the disease. So with all that, and knowing that the vaccine is safe, many people do not vaccinate their children. And so I've had to, you know, reconcile that, you know, even prior to COVID-19. You know, many families don't vaccinate against the flu or vaccinate at all.
Whenever considering decisions about social policy or about even treating individuals, to think about the risks and the benefits of any kind of action or even inaction. For example, if you're going to treat someone with an ear infection with antibiotics, you make the decision to write an antibiotic prescription, as millions of kids get every year. Most of those kids will do fine with those antibiotics, but a handful of them will develop diarrhea and will get very sick from those antibiotics. So there are risks to the antibiotics, and there are benefits to the antibiotics. Some kids will clear those ear infections by themselves. They won't have needed the antibiotics at all. So how do you really weigh a decision like reopening a school purely on risks without weighing benefits, or without weighing the risks of the alternative action? I think that has been missing from the dialogue, that we have not really talked about what harms have befallen children with the shutdown, at the same time as the benefits of helping other people from avoiding the children spreading the infection to them. And so that part of the conversation, I think, needs to be elaborated better to understand that we're not harming children. Children, as I mentioned, aren't likely to die from this infection at all. And so what harms come to them when they are subject to the schools being shut down, et cetera. We already know mental health conditions in children are skyrocketing at this point. There are many published statistics about rates of depression and suicide and anxiety disorders skyrocketing in children because of isolation and other factors. Child abuse in homes where child abuse is going on has skyrocketed because the kids are trapped at home with their abuser. And most importantly, healthcare for children has plummeted. Everything from routine vaccinations, like the measles vaccine, has fallen by 60%, according to in some areas in the United States, because parents are just afraid of taking their kid out of the home. To other kinds of preventative healthcare that is necessary for children, adolescents, et cetera. All those services are harms when they aren't happening to kids. And so I'm worried about that. I'm sincerely worried about the mental health of our children. I'm sincerely worried about the vaccination rates in our children.
Physical health too.
Yeah, that's true too. I think a lot of families, if they live in an area with a yard or a park, maybe their kids can play. Maybe they're not even getting to do that. But in places with apartments and where there aren't necessarily easy access to play outdoor spaces that are safe, kids are just being kept at home. And that also affects their physical health, their well-being, their ability to socialize and play, their own physical fitness. I think we need to just make sure that as we weigh decisions, that we weigh the harms to the children at the same time as the benefits to the rest of society.
They're coming up with every option, honestly, from just coming back and doing what we used to do, if that's what's happening by then, to revising the full stay-at-home schedule, to everything in between, like hybrid learning, which is what a lot of districts are doing, sometime on campus, sometime at home, splitting them into cohorts so that like half is on campus in the morning or afternoon or day to day. I think last I saw there were 7 different possible schedules. I think we're leaning towards some version of being on campus because I think we realize, along with what I think a lot of people are realizing, it's very important for the students emotionally, socially, mentally, and educationally to be on a campus. They've already spent a ton of time coming up with these 7 schedules, and we'll just spend the next 2 months revising and surveying the parents, the teachers, the students, and seeing what works best, and of course monitoring what comes in from every government, right? Local, city, state, federal, all the way up, following what LAUSD may do. And what I know that a lot of the head of schools of the private schools in the LA area are also just communicating with what everyone's going to do. So I think trying to create a united front. Like a cohort schedule would be, I think for us, it would mean we'd have half the students on campus Monday, Tuesday, the other half the students on campus Thursday, Friday. Wednesday would be reserved for like projects that they could work on in Zooms, and an empty school so that the school could be deep cleaned before the other group came in on Thursday, Friday, then deep cleaned over the weekend before the other group came back. What you do with those cohorts kind of depends on your class. So if for instance, I had students in class on Monday and Tuesday, I could still ask the students that are at home to log in for that day. And we're trying to see if we can get classrooms equipped with an ability to do that, to teach from the classroom, so that if we could project our Zoom onto the big screen so that all those students could see all the students in the class and all the students in the class could see all the students at home, that maybe we could work on something together. But that would obviously be hard for everything. So for every project, it wouldn't work. So you adapt it, and maybe different classes would be different. One thing that I'm doing, since I know that we probably won't be able to do a traditional play right away, getting together with a whole bunch of people for rehearsals, staying after school, etc. I'm taking one of my classes and making that class a class just focused on producing a play. And the play is going to be The Glass Menagerie, which only has 4 people in it. And if I have 16 people in that class, 8 will meet on the first half of the week, 8 will meet the second half of the week. So it'll be 4 acting students and 4 tech students. and then a different 4 and 4. And so it'd be like a double cast play, and they both go, be able to do it. And that play can be done with maintaining social distancing. And then if we get to a point where it is finally time for a production and we do invite an audience in, we can limit the number of audience members, we can separate them and, follow all the social distancing guidelines. So that's how it would affect me in my class. Now, we also have some students that may not be comfortable coming in at all, and maybe some teachers that may not be comfortable or able to come in at all. And so we're trying to adapt for that. And then what does that look like? Well, maybe those teachers that can't come onto campus are responsible for the education of the students that can't come onto campus. If I can live feed my classroom, those students can stay home as well. So again, it's endless possibilities, and no one can really pull the trigger on what it's going to be until we get closer, until things open up every day more and more, but then there's always this looming fear that everything's going to get shut back down again. Like now we can go get haircuts. I haven't yet, but we can. We can sit down in a restaurant, and so for all we know, come the end of August, it may be fine. And I see kids everywhere are hanging out together because they've been trapped in so long. So if they're hanging out together on the streets, they might come to the conclusion they can hang out in the classroom, but we'll see.
I don't know how scheduling would work, because if our son has to go into school for his own school a few days a week and it doesn't match with our schedules, that would be another thing we'd have to sort out.
If you do a hybrid learning, and you put them into these different groups and you say, okay, only these 16 will be in this classroom and they will only interact with this same 100. The truth is that those 100, if they're home the other 2 days, but I have to send them to a daycare or something, they're going to mix with other people, because I am a working parent. And so is my husband. He's going to be teaching full time because that's what teachers are going to have to do. And I can't watch them. So I will have to put them somewhere. So they will then mix with other people and then bring that back to that. So therefore, it's not going to work.
We're not going back to school. So my university is staying fully online. No, it's term by term. So for the fall semester, it's fully online, with the exception of certain classes that have real need. If you're in a sculpture class and you need to fire, your clayware, can go in and do that, or maybe lab work, but barring that, classes are online.
Wow.
And for Pyatt, how do you feel about going back to school?
I feel a medium okay about going back.
Why is that?
I just feel like we're normally pretty close together at school, so I'm just worried that I might reinstate cause a spike, and that there won't be that much social distancing.
The virus definitely does better at spreading in indoor spaces than outdoor spaces. And since most schools are indoor spaces, there will be much more exposure for kids if they go to school than if they stay at home. Their exposures, again, aren't likely to result in any major harm to children, right? So we're not going to see any significant impact on the kids. But when they get the infection and asymptomatically or pre-symptomatically spread it then to their grandparents or to their aunts and uncles, that's the harm that's going to arise as schools open. So I think there is a rational basis there to at least ask the question about allowing kids who carry that extra risk of being in a home with an elderly person, being in a home with someone who has those risk factors, to make sure that they don't get forced into going to school and potentially then heightening that risk. The converse of that may be that in places and households where the kids aren't exposed to that extra person in their home who they could infect, that those kids may have less risk of going to schools, because even if they do get sick and even if they do bring it home, they're unlikely to actually increase the amount of deaths. They will undoubtedly increase the number of cases. Let's be totally honest. Kids are constantly sharing secretions with each other. They talk loud. Talking loud is a very well-known risk factor for making larger droplets and spreading the infection. The kids are going to get sick. The kids are going to spread the sickness to the adults around them. That is the reality of how respiratory viral infections work. It happens every year. We don't have to guess about this. It happens every year with all the major respiratory viral infections, from RSV that happens in the fall to influenza that happens in the early winter through February, to the parainfluenzas that spread through the winters and into the spring. Respiratory viruses travel from kids to parents all the time. That is the reality. The impact of that, I think, needs to be weighed on a school district basis, on a classroom basis, and even on a per household basis, for people to be able to decide what is their risk with guidance, with public health guidance, so that they understand should I send my kid to school, and be able to get some actual rational answers around that.
I don't know, for me it would be like, all teachers should be having tests at least once a week.
The only person who had the spot-on response to this was Jeff Bezos in his annual letter to investors. Because while normally this whole annual letter, you can look it up online, for the 2020 annual letter, normally it's all about earnings and things. This year, the entire letter was about the pandemic. And basically, to make a long story short, his point is, the way to beat this is through testing. So what they're doing at Amazon, they spend hundreds of millions to basically test Amazonians on a very regular basis. All right. People who walk into the warehouse are automatically scanned for temperature. They can do constant testing, and his point was that while Amazon can afford that, the average company will not. But that's where the governments come in. What we should be doing is to test everyone and put all the attention on testing, because all you really need to do to contain this disease is find the people who have them, separate them and treat them so they get well, hopefully, but keep them away from everyone else. That's all you need to do. If we would just test everyone. So what they should do in the schools, test them. Once a month, I don't know, and on a daily basis, check the temperature, I don't know, whatever is feasible medically, but test them regularly. Who have it, stay home. Doesn't have it, come on in. They don't need a mask.
I mean, here they decided against the mask because they thought kids will get scared, with seeing adults with masks, which again, trying to balance, health with pedagogy,
One obvious answer is smaller class sizes, which is more expensive for the university. Mm-hmm. Just like person-to-person teaching is more expensive than online teaching, where you don't need classrooms. Mm-hmm. So it would just be more expensive. It would be an issue of investing in real education that deals with the entire person, not just the kind that's engaged by, or the part that's engaged by the keyboard and the mouse.
Mm-hmm. But also schools, I don't know how it's happening there. They are given general advice, and then they have to sort all these things out. And if you're going to do that, I think you need proper support. You need medical experts to be going into schools, to say what needs to be done, what, let alone, all the cleaning services. Are they willing, especially public schools, right, or the authorities, will they invest what needs to be invested to keep schools clean?
How is that going to work when a lot of schools, particularly public schools, don't have the manpower and they don't have the resources, the money to do these things? Prior to COVID-19, one of the biggest, conversations in education was class size. Our teachers went on strike in LA Unified to reduce class size. And it was so controversial, and I would still argue that our class size is too big, right? And one of the pushbacks is we don't have the money. Well, now we're facing a pandemic where, reducing class size seems like the right thing to do, not just for infection control and to protect the community, but the right thing for education. But how will we do that when we don't have the money? Particularly when our state is operating in a deficit, and our economy is, crashing. And so we talk about these things, but I'd like to ask someone, like, is the money there? Are the resources there? Is this really going to work out?
Or they could be taking time off and gaining valuable experience doing other things, and coming back potentially. I mean, that doesn't help secure my job, but that's another alternative.
I feel like we're all very lucky to have the technology we do. And that has been a learning curve, but I'm definitely more comfortable now. I've learned a lot of really helpful teaching and technology techniques during this.
Well, the trend, in general has been towards online education, which in my experience is more efficient administratively and maybe more advantageous for certain people who are administering the education and maybe profiting from it. But I don't think there's all that much good that it does for the students. There's no substitute for having to sit in a room with other people and think and talk and sort of listen to what they have to say and respect it and have the ability to look them in the eye and disagree with them respectfully and see if you can persuade them. This sort of service industry model where somebody pays and then they click a few buttons over the course of the semester and then they get a grade and move on I think is not educating people. So I don't know what's going to happen, but I hope that there's some resistance to what this is undoubtedly doing now, which is pushing a lot of education further online, which was again already happening.
Yeah, and I think that's also a lesson about, the old things digital as well, right? So this idea that, we can do things as well and even better, because we have the tools or whatever, but you don't have, the affective, that visceral experience, that the unspoken language, all these things are disappearing, of course.
I said to my assistant head of school just the other day, I said, if this is what teaching is going to be like for much longer, I don't know if I want to be a teacher anymore, because there's not a chance to connect. And we'd had 2/3 of the year to connect with these students. And so I think it made the transition easier. But if you start off the school year like this with no real connection, and I'm in a Zoom meeting with 20 kids and I have no connection to them, I don't think it'll be successful. So that's my concern for the fall.
Because we're very fortunate and we are privileged, and we have resources, they both have had access to the internet from day one, right? Their schools converted immediately to an online education. And then in addition to that, they have extracurricular activities. I didn't mention Simone takes Spanish class now, 2 to 4 times a week online. And she was also still involved in choir in addition to all the reading that she's done. So they have other activities that are being enhanced, or that, we're enhancing their education with other activities, probably a little bit more so than when we were doing before. I worry not necessarily about my kids, but I worry about children in general, throughout the United States and throughout the world who, for example, in the state of California, there are still children as of today who don't have a device and who are unable to access a virtual education. I think it's well over 100,000 children in the state of California. I can't remember the statistic, but it's much more than we think. One is their school may not have a device, their family may not have a device. If they have the device, they may not have internet in their home. And depending upon their age, they may not have the assistants at home to hook up to the internet and to guide them through their virtual education. And as we know, I think many children need help, when they're being engaged in this type of education. So there is no doubt that many children aren't receiving an education right now. And the long-term effects of that, I think, will be unprecedented. And so I do worry about that, about children who don't have the same access as my children.
And assistive technology has always been a key kind of aspect of special ed, or kids who need communication help with iPads that can talk for them, or these kinds of things we need more funding for that.
The founding principle of our school, though, was to maintain a diversity, and it's a diversity in ethnicity, geography, socioeconomics. So a big portion of all of our money goes towards making sure that any student can come to our school. So we actually operate like in the red, and on a very fine line budget. And so to do that would put us in debt unless we did have generous donors within our community that would help us with that. I think the main reason we have it easier is actually not because we're private and whatever financial thing that may benefit, but because we're smaller. My school has 285 students. So to be able to separate those students, to be able to keep them in smaller groups is a lot easier than a school with 1,000 students. I think that's the main issue that we're dealing with, that benefits us, is the size. Because I know we don't have the money sitting around to just retrofit everything.
I work in a school which is like mostly Black and brown people, and COVID-19 has disproportionately hit people of color, and so I'm just wondering like what that's going to mean. Like it's people are hit economically, so I just wish that people were being taken care of, that there would be like more stimulus money to take care of families so that people could really stay home until it's safe to go out.
I mean, look what's happening. Look who's dying most. There's a reason for that. That's built into our system. That's how our system is supposed to work. And we certainly don't have a leader right now who is supportive of all kinds of people.
Like a VR would be like the next best thing from in person. It's like, like you can like kind of talk to them up close. So yeah, but like it's unlikely because of the cost of the VR equipment, which is $2,000 each. If we like used our entire weapons budget for a year and then transferred that to VR, we would actually be able to do that with money to spare. But again, this country is weapons crazy, so I highly doubt we're ever gonna do that. Screw education, more nukes!
Now that we're like in this, what is school? What does it look like? And where do we do it? And maybe it's not in person. Maybe we meet at a park outside. Maybe we meet, 5 of us at a time, every other day. Who knows, right? That now this is kind of an opportunity to really address like all of the things that we need. And it's interesting, it's happening right at the same time as, today is Juneteenth, happy Juneteenth, that it's happening at this really time of change, that if we can take money away from policing and give it to education and housing and healthcare and, supporting families, I think everyone now is like, oh my gosh, yes, this is what we need to do. I think, or at least the majority is really fed up and sick of how things have been working. And for this to all be like sort of culminating at the same time is kind of exciting too. There's so much like opportunity now to rethink how we educate our kids, how we treat teachers. Probably we should be paying them a lot more. How police get a lot more funding than education is kind of curious. How is that? Is that really our priority? Do we want that going forward? It's kind of an amazing time. Certainly anxiety provoking and destabilizing though. And in some ways, I guess that's what needed to happen for a lot of these realities to come to the forefront and to hopefully be changed.
There are so many experts out there that actually are trying to bring emotional resiliency and intelligence to the schools.
I think learning really needs to be geared towards what they need in life. In history, for example, they learn about, these people and those people, but I think there's history that really matters. And there's history that is purely interesting for those who like the subject. I could talk for 5 years about the history of this country and make people learn something that they can use in life. There is so much to know about it. Or the example of countries like Germany that have a history that you don't want to have repeated. I think it's important to know what brought those factors about, because these factors can happen today just like they could 80 years ago. It's not that long ago.
But there also is a lot on the internet as far as like a social justice education or how to address some of these issues too. You have to just kind of put the books aside, the textbook aside, and rise to the occasion of what's happening in the world. And that's what the kids need to be talking about too. They need to be processing it and listening to it. And like so much of the curriculum is geared towards tests. And so maybe it's time to reevaluate that and look at the whole needs of the children. Because if our goal is to have children who understand different perspectives, who have a higher self-esteem, you have higher emotional intelligence, your self-esteem is going to be higher. So if you're creating a generation of children who have these emotional, psychological, mental skills, and good communication skills, you're really preparing them for the world of deeper understanding and patience and empathy and compassion for others, and to be critical thinkers so they don't go out there and bandwagon. What's fake news, what's real news, and how do you discern this? There's how to really teach discernment.
I think that parents and teachers can really team now in a different way than we've been able to before, because parents are aware of like, oh gosh, I guess my kid can't really focus for more than 2 minutes at a time. So how do I learn how to stretch that? How do I use that strength and make it 3 minutes? The hardest thing for parents to be as teachers, we're parents. Like we I don't know, it's for Roman and I can help him, but it's different than when I work with my own students. It's different when I am working with my own son. But there are some realities about how our kids function or behave or what their abilities are that we never understand or see, and that teachers sometimes try to broach.
I know a lot of parents want schools to reopen because they have to work, but I was wondering what do parents think if that was not an issue? Would they still want in-person schools to open now in the situation that we're in?
Considering things are going to change at even at college level and all that, how is the education system and then the workforce going to look like? And what can we do to prepare them to work in the future and find jobs and make a living, basically?
Of course, a question that I would also ask governments and digital companies of how they're going to be using all this data that they are collecting or they're planning to collect in order to control the pandemic, so that they ensure that people's privacy and fundamental rights are protected.
I feel like right now all we do is blame that we're not able to get down to New Zealand levels. Like, hooray for New Zealand! They have an amazing prime minister compared to what we have, and they have an amazing stats to back it. We don't, and there's something about us that makes us not so good at controlling this virus. So I think rather than just blaming policy, which we have lots of things to blame in our policy, but we should try to understand what structural things are in our society that make us have this ongoing caseload. And I think that's going to help inform the next wave of policy decisions. We can't just say we should be like Iceland, right? I think we all dreamt of that maybe 2 months ago. We cannot be like Iceland, though. We cannot be like New Zealand. There's a reason we can't, though. It's not just like throw up our arms and say, oh, well, we're not like New Zealand. But like to try to understand why we're not like New Zealand and what makes us have this extra risk, those are where we should be targeting our policies. And I have not heard that level of discussion.
we still have to all work together, right? That's the only way that we're going to get through this, is that as a community, we need to work together. And that's difficult in 2020 for lots of reasons.